Ready, Bob?
Ready.
Good morning, everybody. Welcome to the June 17th Lebanon County Commissioners meeting. This meeting is being recorded and will become part of public record. Anyone wishing to comment, please use the raise hand function at the bottom of your screen, and if the chairman allows, we'll bring you in.
Thank you, Dawn. Good morning and welcome to the June 17th Board of Commissioners meeting. And as is customary, we will begin our meeting with a moment of silence. Thank you. Please rise for the pledge to the flag. I pledge allegiance
To the flag
of the United States
of America
and to the
To
republic
the republic
for which it
stands,
stands,
one nation,
one nation,
God,
under God,
indivisible,
indivisible, with liberty
with liberty and justice for all.
Thank you very much. And now we'll look for any attendees who would like to participate in public comment this morning. Okay. Raised hands, we will ask for the approval of the minutes of our workshop of June 2nd and our last public meeting of June 3rd.
Make a motion to approve the minutes of the previous meeting.
2 meetings, right?
Yes.
I'll second that motion.
Okay, it's been moved and seconded that we approve the minutes of those 2 meetings. Any additions, deletions, or corrections? Hearing none, all in favor of the motion, please indicate by saying aye.
Aye.
Opposed, same sign, so ordered. Thank you. And now we'll go to the treasurer's report.
Hey, good morning, everyone.
Morning, Sally.
We had receipts on 6/15 and 6/16 of $146,022.16. Our total cash is $3,623,079.56. We had expenditures of $1,293,334.21. The undistributed tax claim is $84,568.60. So we have a cash balance of $2,245,176.75.
I'll make a motion to accept the treasurer's report as presented.
Second.
It's been moved and seconded that we approve Treasurer Nguyen's report. Any comment or question? Hearing none, all in favor of the motion, please indicate by saying aye.
Aye.
Opposed, same sign, so moved. Anything else this morning, Sally?
Nope, that's it.
All right, thank you very much and have a good day.
Yep, thank you.
All right, we'll move to our HR report with Ms. Snavely is with us this morning. You'd like to introduce yourself and your position.
Michelle Snavely, Human Resources Director. Moving on to personnel transactions, resignations, and terminations. Andrew Henning, Operations Technician, resignation effective May 31st. Dakota Fulmer, Telecommunicator, resignation effective June 25th. Kathy Wingert, Part-Time Assistant DA, resignation effective June 4th. Owen Hanna, Assistant District Attorney 1, resignation effective July 1. Jalessa Johnson, General Clerk A Floater, resignation effective June 22nd. Barbara Sokovic, Full-Time Correctional Officer, retirement effective June 8th. Marlene Klinger, Casual Part-Time Correctional Officer, removal effective June 17th. Lauren Ebright, Casual Part-Time Correctional Officer, removal effective June 17th. Rebecca Bernard, Caseworker 2, resignation effective June 30th. Christina Bingham, Probation Officer 1, resignation effective July 2nd. Melissa Bowers, General Clerk C, resignation effective June 18th. And Kristen Weaver, Program Assistant, retirement effective August 7th.
I'll make a motion to approve the resignations and terminations with special acknowledgement to Kristen Weaver, who has been with us since 1989. And also I see that Barbara Sikovic has been with us since 2005. So those are pretty significant, and I wish them well in their retirement.
I'll second the motion.
It's been moved and seconded that we approve those resignations and terminations with a special note of the longevity and thanks to those that have served the county in their retirement. We wish them well. All in favor of the motion, please indicate by saying aye.
Aye.
Aye. Opposed, same sign, so moved.
Under leaves of absence, Jennifer Lurch from Domestic Relations, 11-week leave of absence effective June 30th. Hayden Murphy from the prison, 9-day leave of absence effective June 17th.
I'll make a motion to approve the 2 leaves of absence as presented.
Second.
It's been moved and seconded that we approve those LOAs. Any comment or question on the motion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Under changes of status, transfers, and promotions, I have a motion to approve District Attorney Pierre Hess-Graf's recommendation to eliminate the 2 part-time assistant district attorney positions within her department to create 1 full-time assistant district attorney 1 position effective immediately June 17th, 2021.
So moved.
Second.
It's been moved and seconded that we approve District Attorney Graf's recommendation. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Madison Stickler, transfer from accounting clerk C in the treasurer's office to accountant/auditor in the controller's office at the rate of $1,329.32 biweekly effective June 28th. Mary Griffith, promotion from jury attendant in the courts department to a court attendant at the rate of $11.90 per hour effective June 14th. Robert Gibson Jr., promotion from correctional officer at the Lebanon County Correctional Facility to sergeant at the rate of $31.85 per hour effective June 27th. Renee Ream, change of status from full-time developmental assistant at Renova to casual developmental assistant, no change in her rate effective June 27th.
I'll make a motion to approve the transfers and changes of status as read.
Second.
It's been moved and seconded. If there are any comment or question, we'll hear them now. If not, all in favor of the motion, please indicate by saying aye.
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 Opposed, same sign, so moved.
Under other transactions, I have a motion to accept Holly Leahy, MHIDEI Administrator's recommendation to eliminate 19 of the mental health unit caseworker 1 and 2 positions and all 3 casework supervisor 1 positions effective July 1st, 2021. These eliminations are a result of the discontinuation of Lebanon County's license to provide targeted case management services through MHIDEI. These services will now be provided through a private company.
So moved.
Second.
It's been moved and seconded that we approve Holly Leahy's recommendation. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Area Agency on Aging would like to hire Michelle Remlinger as a part-time senior center manager at the rate of $12.30 per hour effective June 28th. The Department of Emergency Services would like to hire Kyle Boyer and Henry Spittler, both as operation technicians, both at the rate of $12.30 per hour, both effective July 20th, 2021.
Make a motion to approve those 2 hirings.
Second.
It's been moved and seconded. Any comment or question? None, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so ordered.
There are no questions regarding the transactions presented. Is there a motion to adopt these transactions onto the salary board?
So moved.
Second.
It's been moved and seconded that we approve all those recommendations under the salary board. Any comment or question regarding the motion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Thank you.
Thank you, Michelle.
Morning.
Good morning.
Well, good morning.
Leanne Shank, Human Resources Assistant with conference seminar requests under mandated. I have Jason Weichel, Brianna La Liberty, and Gary Verna from DES would like to attend the G290 Basic PIO in Lancaster, August 5th and 6th, meals reimbursement, 16 credits mandated by PIMA. And Brianna La Liberty from DES would like to attend the D191 ICS EOC interface training online June 18th, $150 total registration fee mandated by PIMA. And Rachel Speck and Nicole Williams from Probation Services would like to attend the payment plans and enforcement training in Mechanicsburg, October 1st, meals reimbursement, 6 credits mandated by PBPP.
Make a motion to approve the conference and seminar requests as presented.
I'll second the motion.
It's been moved and seconded that we approve those mandated requests. Any comment or question regarding the motion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Under non-mandated, I, Brian Diedrich from Public Defender's Office would like to attend the Chiefs Conference in State College, June 28th and 29th, mileage reimbursement, no other reimbursement.
I'll make a motion for the public defender to attend the training.
Second.
Been moved and seconded that we approve Attorney Diedrich's request. Any questions regarding the motion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Dawn Black and Denise Fravel from Recorder of Deeds would like to attend the PA Recorder of Deeds Association Conference in State College, October 12th through the 14th, $400 total registration fee with lodging and mileage reimbursement.
Make a motion to approve Dawn and Denise to go to the Recorder of Deeds Conference.
I'll second the motion.
It's been moved and seconded that we approve the requested by the Recorder of Deeds Office. Any questions or comments regarding the motion? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign, so moved.
And Michael Anderson from Voter Registration would like to attend the 2021 PA County Election Officials Conference in Macungie, August 1st through the 5th, $250 total registration fee with lodging, mileage, meals, and tolls reimbursement.
I'll make a motion to have the elections director attend the conference.
Second.
It's been moved and seconded that we approve sending Mike Anderson to Macungie. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign, so moved.
Thank you.
Thank you, Leanne. Okay, I see Holly Leahy has joined us.
Yes, good morning. Thank you so much for coming to the meeting. My name is Holly Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Programs. With me this morning is Sue Douglas, our Director of Fiscal Operations. This morning, we are presenting several budget-related items for your review and approval. So we will begin with one outstanding contract amendment from fiscal year 1920 for early intervention. This was due to increased utilization for the service. The contract amendment totals $6,487. These expenses were covered by the approved budget, so we're not requesting any additional county funds to cover that amendment.
Motion. Seeking a motion.
I'll make that motion. Yeah.
I was cut off twice and came in rejoining, so I don't know what's going on.
Oh, okay.
I'll second the motion.
Okay, we have a motion and a second to approve that contract amendment. Any questions regarding the motion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Next, we have contract amendments for fiscal year 2021. These are totaling $112,367. There's 21 contract amendments in total, primarily for increased utilization of services within the ID and early intervention programs. All of these expenses will be covered under our current approved budget and block grant funds. We are not requesting any additional county funds.
Motion,
I'll make a motion to approve the 21 contracts.
I'll second the motion.
right, we have a motion and a second to approve the 2021 contracts, and there are 21 of them. So we'll have that motion, and any further discussion or comment? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Thank you. Next, we're requesting approval for all of the mental health, intellectual disability, early intervention provider contracts for fiscal year 2021, 2022. This is a total of $3,839,954, which represents a decrease of $157,693 compared to fiscal year 2021. Just a few highlights is that we did have some decreases in our intellectual disability non-waiver contracts. We also had a slight decrease in our early intervention non-waiver contracts. In our mental health program, we did have an increase, about 29%. And then our support services contracts increase of about 5.6%. In summation, we are asking your approval for all the provider contracts for fiscal year 2021 and 2022.
I'll make a motion to approve the contracts for 2021 and 22.
Second.
Okay, we have a motion and a second. Any discussion? Hearing none, all in favor of the motion, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
And then we have presented our overall agency, MHIDEI agency budget for fiscal year 2021, 2022 for your review. For expenses, we are projecting $7,740,000, which is $781,000 less than fiscal year 2021. In revenues, we're projecting $7,049,000, which is a decrease of $755,000 compared to 2021. We are projecting overall deficit, agency deficit of $691,000. That's representative of mental health in the amount of $478,000 and early intervention in the amount of $213,000. Our required county match based upon our allocations is $351,000. And so we're looking at county support for 2021. We're at $600,000. We do believe that we will be able to stay within that $600,000. And at the end of this year, we will review the budget for potential county support for calendar year 2022.
Fair enough. Is there a motion?
Holly, question quickly. Is that $600,000 more or less than the county support from last year?
That remains the same from last year. So as we look at this upcoming year and actually the next fiscal year 2022 and 2023 will be transitional years for us as we begin to decrease our costs for retirement and direct costs related to the privatization of targeted case management. So for this year, it still remains at $600,000. But again, we do believe that as we progress through the next several years, that amount will decrease in the amount.
But for now, it's the same.
For now, it is the same. Yes.
So moved.
Second.
It's been duly moved and seconded that we approve the budget as presented. Any further discussion? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved. Thank you, Holly. And Sue,
Thank you. Thank you.
Jamie has a comment or question.
You're on mute, Jamie.
Before they go, and this is putting Holly on the spot a little bit, but could you give a brief update on the transition over to SAM for targeted case management? I know it seems to be going pretty well, all things considered, but a little update since we're just about there for the full transition in July.
Yes, actually, the transition to service access and management, or SAM, as the provider of targeted case management in Lebanon County is going extremely well. The provider is moving through all of their required tasks very quickly. They already have their license through the Department of Human Services. They're now working through to obtain their provider number through PA Promise system, but they have already accepted 177 cases to be transferred over. These are for individuals and families that have completed a release of information to be transferred to SAM as their provider. And so they will begin to work through the process of completing the intake, and that's basically required paperwork to begin services. So they're right on target to begin those services with those individuals as of July 1, 2021. At this point, they have been able to hire 2 supervisors, which is adequate at this time. And then they've hired 4 blended case managers to provide that service as well. They continue to interview for blended case managers. So they are taking applications and currently seeking applicants for blended case management. And we're really excited to see what all of that brings as we continue to go through the process with SAM, but it is progressing very quickly.
Good. I know
Okay,
that was nervousness for you.
Yeah, I just want to add thanks to Holly and Sue and the whole team for their diligence and their, what they faced in the last few months, and faced it very professionally, and we thank them for their service to the county.
And we will like to express our appreciation for all the commissioners and for all of your support as we've gone through this process. It has been a difficult process, but we're headed into a great phase here, and I think it will be very positive for our community and those that we serve. So thank you very much.
Right.
Thank you, Holly. Thank you.
Welcome.
Okay.
Right, next on the agenda is Carol Davies from the Agency on Aging.
Good morning, I'm Carol Davies. I'm the administrator of the Area Agency on Aging. With me today is Ann Devine, our deputy administrator, and Doreen Klein, who is our fiscal officer. We're here today to present 2 items for the commissioner's review and approval. The first are some contract amendments, or actually just one contract amendment for the fiscal year that ends June 30th. And it's actually just one small contract with an increase totaling $32. And we do have funds available within our budget for the current year to pay for this expense.
Okay,
Make a motion to approve the contract amendment.
Second.
okay, that's one I think we can all agree easily on.
We'll split it, Bob. We'll
You
split
betcha. All right, that being said, any further discussion? Anything? Nope. All in favor of the motion for this contract amendment, please indicate by saying aye.
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 Opposed, same sign, so moved.
Thank you. I'd like to start with an easy one. The second item we have for approval today are our contracts for the new fiscal year that begins July 1st. So these are contracts for the fiscal year 2021, 2022. There are 35 contracts listed. The total value is $1,136,260. There are no significant changes in the types or array of services we are providing since the prior fiscal year. And most of the contracts are continued at the same rate per unit as they were in this current year. And that's because we generally are not able to make increases in the rates until we get a message from the Department of Aging, which we usually receive sometime after the beginning of the fiscal year, that would allow for cost of living increases in the contracts. Related to the contracts, we also present our budget for the 2021-2022 fiscal year. And in the budget, we have total revenues and expenses of $4,105,198. This is just basically a 1% increase over the prior year. There are just a few items I'd like to mention regarding our revenues. Number one is that the Department of Aging was required to change their interstate funding formula, which is the formula they use to allocate federal funds to all the area agencies on aging in Pennsylvania. And based on the new formula, which is based on population data, including number of older adults in poverty, living in rural situations or in minorities. So we have slightly increased the amount of funds we'll receive under that formula. And because of the impact that funding formula has on some other area agencies on aging, the additional funds we are going to receive are going to be phased in gradually over a number of years. We will have a total increase over time of $100,000, but for this year, the increase is just over $20,000. We also benefit in our budget this year from some money directly related to the COVID emergency situation.
Okay. And point number 6 is that you're not requesting any additional county.
Oh, yes, I should say that, definitely.
Okay. If seeking a motion to approve.
I just have a couple of questions for Carol first.
Well, let's get the motion on the floor, please. And then we can have discussion.
All right, I'll make the motion to approve Carol's request since there's no increase, but I do have questions.
I'll second the motion.
All right, now it's the proper time for discussion, so let's proceed with that.
Carol, you mentioned a waiting list. What kind of waiting list do you expect in item D for personal care?
We do have a number of people who we have determined would benefit from receiving in-home personal care. And because of the employment situation across the state, not just here in the county, our providers are not always able to provide the services that we request them to provide because they cannot find sufficient staff to provide the services. So in accordance with Department of Aging policy, we are going to move to establish a formal waiting list. Right now, people are waiting kind of informally, but we do want to be able to formally document that fact that these people are waiting for services. If you remember, a number of years ago, we had a waiting list because we were short of funds. In this case, it isn't because we don't have the funds to pay for the service. It's because the providers are unable to provide the services when we request them.
Okay, but you don't have any idea what that might look like, 10 or 100?
Right now we have, Ann, can you help me? Maybe 60 people receiving service? She's on, you're on mute, there you go.
Receiving service or on the wait list?
Do you know either?
Hold on one second.
What is Commissioner Litz's question?
She's trying to determine how many people are impacted by the
I mean, is she asking for the waiting list versus being served now? I think is what.
That would be, both of them would be interesting to know, though.
If you don't have them, Ann, I can send them over when we get them.
That would be fine.
Okay.
And then the second question is, what two adult daycares closed? Does that add to the list at all?
There were two adult daycares that closed. One is located out of the county, but there were times when we did send people there. The other adult daycare that closed was the Avenues location that was located at Londonderry Village in Palmyra. And Avenues did cease operation of that adult daycare in September of last year.
All right, thank you for the update.
Sure. And did you come up with your numbers?
I did. Joellen,
Great.
we had about between 50 and 60 people currently receiving personal care. And as of the end of May, there was about 23 people waiting for service.
Okay, so it can be a significant wait. And we do have the ARP funds to supplement for 3 years, the way it reads.
That's correct. We have not received real specific guidance as to what exactly we may use the American Rescue Plan funding for, but we do know that that's available to us over 3 years.
Okay, thank you very much.
You're welcome.
Okay. Any further discussion or questions? If not, all in favor, please indicate by saying aye.
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 Opposed, same sign. So moved.
Okay, thank you very much.
Anything else? Thank you,
Thank you,
folks.
Carol.
Thank you.
You're welcome. Bye.
Okay, Jim Dunmoyer is up.
Good morning.
Morning, Jim.
Good morning. Good morning.
My name is James Don Moyer. I'm the executive director of Lebanon County Drug and Alcohol. I'm here today to present two things to the commissioners. The first thing I'm here to present is contracts for the 2021-2022 fiscal year. And I'm also here to talk about the 2021-2022 budget. So the first thing I'd like to talk about is the contracts for 2021-2022. I provided the commissioners with a list of all the contracts that the Drug and Alcohol Agency currently has. We have a total of 43 provider contracts. Out of those 43 provider contracts, there's over 65 facilities with those contracts. And Lebanon County has a full continuum of care for Lebanon County residents seeking drug and alcohol treatment. There are no new added providers in 2021-2022. We are not adding any more facilities in 2021-22. However, we are adding some programs, more programs. A total of 6 new programs will be added to those provider facility contracts. I did provide a list, new additions and changes, along with this list of our current contracts. You can see we're adding some new programming at Pyramid, who we already contracted with, but we're adding programs with. We're adding programs at White Deer Run. We're adding programs at Bradford Recovery. You'll see there has been a name change with the Penn Foundation. You'll also see on here where we dropped our contract with the CAP, Lebanon County CAP, and that contract was assumed by Mental Health IDEI. We are contracted with them instead of CAP. So those are the contracts. The rates on the contracts have increased. There's a couple reasons for that. Basically, the cost of living is one factor. The other factor is COVID related. And the third factor is all the providers in the state of Pennsylvania need to become ASAM aligned, which replaced the PCPC last year. So there are costs that the providers are incurring. They will incur, and that's the reason for some of the rate increases.
Would you, for the sake of the attendees, tell us what the acronym is for ASAM?
ASAM is substance abuse It's basically what we use. It's an assessment tool that we use to determine the level of care for someone entering treatment. So
Excellent. Thank you.
we use that. That's our tool. It used to be the PCPC, and the state changed that and turned it into the ASAM. So it's just a different tool for when we assess folks going into treatment.
Thank you, Jim. Okay, anything else before we ask for a motion? We good, Jim?
Yes, I'm good.
Okay,
All right, I'll make a motion to approve adoption of the 1921. That would be nice, right?
I wish.
2021-22 contracts as presented.
Second.
okay, it's been duly moved and seconded. Any further discussion? If not, all in favor, please indicate by saying aye.
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 Opposed, same sign, so moved.
Okay, the second thing I have is the 2021-2022 drug and alcohol budget. I want to point out in 2020, 2021, our current year, our budget for revenues was $1,994,720. In 2021, 2022, our revenue budget will be $2,172,725. So it is an increase of $178,005. I also want to point out for the commissioners, in the past 8 years ago, our budget set at 1.237,686. So in 8 years, our budget has just about doubled at drug and alcohol. That is a good thing because the budget's doubling because we are receiving more money from the federal government and we're receiving more money from the state government. It is not costing the county any kind of increase in participation. Just some things I want to point out this year. One thing you'll see on the revenues, compulsive gambling, you'll see for 2021, 2022, we're only receiving $33,800. And you can see the year before we received quite a bit more. That's due to the lost gambling revenue as a result of COVID. So counties are getting less money through compulsive gambling funds through DDAP. However, DDAP has turned around and graciously gave us more federal store money. So as you can see, in 2021-22, we'll be receiving $458,208 in SOAR money, which is a substantial increase from the previous year. So we lost the gambling money, and basically they backfilled it with more SOAR's money. And actually we came ahead, a total coming ahead of $59,034. If you go down the revenues, you'll see federal funds. Our federal funds also increased for a total of $46,000. So between federal funds and the Department of Drug and Alcohol, we're receiving over $105,000 more in funding. You'll also see that we received a $30,000 increase from the Department of Public Welfare for BHSI funding. And you'll also see, as you move down further the revenue list, the county funds for rental. In 2021-22, it'll be $192,489, which is $43,000 more than we got the year before. And the reason for that is because during COVID, we provided the Arcadia Health some relief from the rent. So this year, now that we're through COVID, the rent will go back where they'll be paying a full year's of rent, where I believe this year they paid 9 months. So that's the difference. That's why it seems to be an increase. But, you know, again, we gave them a break in the rent through COVID. So financially, budget-wise, the Drug and Alcohol Office is in great shape, in my opinion. Again, as always, we're not asking for any county support. The county general fund, we have ample money to do what we do.
Do you need a motion to approve your submittal?
I would ask that you have a motion and you approve the 2021-22 budget.
I'll make a motion to approve the budget as presented, and then I do have a question.
I'll second the motion.
Okay, Commissioner Litz.
Thank you. Jim, on television, I see so many gambling venues where people can do it electronically. Does the state not get a portion of those funds?
That is something that I really don't know and don't know the answer to. All I know is what we're told is, under compulsive gambling, I don't know what that includes in the state of Pennsylvania. I don't know if it's just in-person casinos revenue. I don't know if it's online gambling revenue. I could not answer that for you. That would probably be a question for the state. All I can tell you is that, as our allocation, you can see that we took a decrease in compulsive gambling funds. But then DDAP, like I said, was gracious to backfill it with SOARS money.
I understand. I just didn't know if they were undercutting the source of revenue to treat people with the addiction.
No, they're not. They're just, we have the same amount of money. In matter of fact, we have more money in 2021, 2022. With the combination of SOARS and gambling, the amount we have is more than we had in 2020, 2021. It's just the fact that less is coming through the gambling part of it.
I understand.
So it's not affecting.
It's more in the taxpayer realm than those who are doing the gambling.
Correct. It's more federal money coming through taxes, you're correct, than people gambling.
And is any of that the ARP funds? American Rescue Plan funds,
No,
that will disappear?
No, I don't think that the state or anyone has allocated them into that kind of category just yet, or if they are. And as far as the online gambling goes, I think that is a question for the state. I mean, we're just on the receiving end of whatever the revenues end up being, but without knowing for sure, I'm pretty certain the legislature would be chasing down any kind of revenue for online gambling, just as they did for in-person gambling. If maybe it's a matter of catching up or something to the industry, I'm not sure.
They did that with sales tax too. Yeah, to catch up. Thank you, Jamie and Jim.
Your motion in a second. Anything further, Jim, that you want to add?
No, sir.
Okay, otherwise, I thank you for such a good budget and for the continuum of care that you've developed over the years in your department. That we have this wide array of services available in Lebanon County, and we have the funding to take care of them. So I think overall, you hit the bullseye on that. So thank you.
Yeah, the only thing I'd like to say, Commissioner, is I want to reiterate that if someone is in need of drug and alcohol treatment, Lebanon County has the full continuum. We have the contracts available to us. We have the funding available to us that we can help people in our community. I also want to, my staff, my entire staff, proud of my entire staff for, like I said, when a budget increases just about, it doubles, along with that comes a lot of work. So, we are building new programs. We're making sure existing programs are still moving forward. So I think it's a credit that we could grow the budget double in 8 years. So I just wanted to put that out there.
All right, thank you, Jim. All in favor of the motion, please indicate by saying aye.
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 Opposed, same sign, so moved. Jim, happy Father's
Thank
Day.
you. Thank you.
Thank you, Jim. Now Commissioner Phillips got cut out.
Yeah, he went over to the attendees. Bring him back, Dawn.
Dawn's not there.
Here he comes. Yes, she is. Here he comes. Took a little ride, Bob.
Go for a stroll or what?
Oh,
Now
you're
you're on
muted.
mute too, Bob. That's what happened to me.
On the left. Okay, thank you. Yes, I needed a little break there. Thank you. So now we go on to Jamie. You have a few items to bring forth.
Yes, thank you. First, I have some liquid fuel application for county aid. Only one of them is for Heidelberg Township. Would like to apply their funds to their seal coating project of $13,825. Their allocation would be $4,069 toward that.
So moved.
Second,
Moved and seconded that we allocate those liquid fuels to Heidelberg Township. Any discussion? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign. So moved.
Okay, I have some real estate tax exemption requests for disabled veterans. Miguel Aponte of Weavertown Road, Lebanon, and Sharon Spencer of Swatara Creek Drive, Jonestown, meeting the requirements for exemptions.
Make a motion to approve Miguel and Sharon's real estate tax exemptions for 100% disabled veterans.
I'll second the motion.
It's been moved and duly seconded. Any question or comment? Hearing none, all in favor of the motion, please indicate by saying aye.
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 Opposed, same sign. So ordered.
I have some appointments and reappointments for the Area Agency on Aging Advisory Council. The reappointments and appointments would take action, but there are also some who are ineligible due to having served the number of terms that the maximum number of terms, which we of course will send them letters recognizing their service, but don't take action for those. I'll go through those. There are three people who are ineligible of serving additional terms due to the makeup and the bylaws of the advisory council. That is Vicki O'Neill in the retiree consumer line category, as well as Phyllis Wolf in that category, and Scott Core from Lebanon County Veterans Affairs, unable to serve a second term. So we will send them letters. And then we have reappointment to a second term for Carol Levengood, a retiree consumer, and Tim George from the caring and hospice industry. We'd take those for a second term if we would, which would go to June 30, 2024.
Okay. We can take that in one motion if that's up.
Reappointments, yeah.
Okay, go ahead. Please provide the motion.
I'll make a motion to make those two appointments to the Area Agency on Aging Board.
Second,
It's been moved and seconded. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign. So moved.
And we have 4 new appointees to serve a 3-year term to June 30, 2024. So that would be the 3 that are stepping down. And also, we do have another member resigning effective June 30, Evelyn Seitz, who is also in the retired consumer. I missed that one earlier. So we'll get her a letter for her service, but then we have 4 to replace all of those vacancies that are new appointees to serve to June 30, 2024. They would be Mary Sample in the retiree consumer category, Brian Smith, who is executive director of the Lebanon County Christian Ministries, Brenda Snyder, a retiree, and Linda Windell of GNL Trophies. You might know her. She's been active in the Children and Youth department a long time, and she would be in the retiree consumer as well. So it's those 4 would be new appointees.
Make a motion to approve Mary, Brian, Brenda, and Linda for appointment to the Area Agency on Aging Board.
I'll second that motion.
Been moved and seconded with our thanks for serving, that we approved these for 3-year terms. All in favor of the motion, please indicate by saying aye.
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 Opposed, same sign. So moved.
Okay, and I have a assurance of compliance form to be approved and submitted on to the Pennsylvania Department of Human Services Bureau of Managed Care. It is for our medical assistance transportation program that you're familiar with, is administered by the Community Action Partnership. And this assurance of compliance simply states that we will follow all of the requirements of the grant and of the participation agreement that we have to carry out the program. It's an annual requirement.
I'll make a motion to approve the letter of compliance.
Second.
Okay, we have a motion and a second. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign. So moved.
And the last one I have is an amendment to the grant agreement that we have between the Pennsylvania Emergency Management Agency and South Central Pennsylvania Counterterrorism Task Force, which we are a member of. More specifically, our Department of Emergency Services participates in the regional counterterrorism task force for a number of funding opportunities and so on. Currently, it exists with Adams, Cumberland, Dauphin, Franklin, Lancaster, Lebanon, Perry, and York. The Eastern Central region, we're in the South Central. The Eastern Central region of counties has disbanded. So they're going down by one region and dispersing those counties that were in that region to some neighboring task forces. In this case, the amendment would be adding Schuylkill County to our task force. And this would then make them eligible for all of the sharing and funding and everything that the task force does. So this is, to my knowledge, the first amendment to this agreement with the task force since it's been in existence. And that is to add Schuylkill County. Does not reduce anyone's funding or anything. They're it's proportionately dispersing the pro rata portion of Schuylkill counties and the other counties in that region to the others then. So would ask for your approval.
I'll make a motion to approve the grant agreement to add Schuylkill County so that we can do some sharing of personnel and whatever is needed with the grants.
Second the motion.
There's a motion and a second to approve an amendment to the grant agreement. Any discussion regarding the motion? Hearing none, all in favor, please indicate by saying aye.
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 Opposed, same sign. So moved. Jamie, do we have anything to do with Evelyn Sites? Are we okay with that? We don't need a motion to. For
What again?
Evelyn Sites with the area agency.
Yeah, she's resigning.
So we don't need to.
No.
Okay,
Yeah.
thank you.
Yeah, she's just unable to serve any longer. Yeah.
Yeah, okay.
And you have one assessment appeal this afternoon at 1:30 on Zoom. So that's all I have.
Move to adjourn.
Okay, we have a motion to adjourn. We stand adjourned. Happy Father's Day to all the fathers out there. Thank you.